Hey everyone, welcome to another episode of Scrubs and Software. Today I'm checking out Informetica, but before I kind of go into that, once again, thanks for joining and watching these little quick videos. If there's any piece of tech or software that is in the AI or generative AI world, would love to play with it, get my hands on it, and share my thoughts. For this company, I was at Health Europe this past summer and briefly crossed paths with their CEO. I thought what they were doing was really, really cool. Reached out and had a call with them, and they kind of gave me this access to one of their triage tools. And so I won't talk much initially. I want to kind of play with this tool, and then we can kind of dive into the history of this company, or some of the offerings they have and whatnot. The main problem they're trying to solve with this is triaging patients to where they need to go to. So I'm an ER doc, and there's a lot of patients that come to the emergency department that maybe don't need to be there, right? They maybe could have gone to an urgent care, they could have maybe gone to their primary care doctor's office, or even gotten home care, over-the-counter medications, things of that nature. And so this is attempting to solve that problem. Now, obviously, this is something that is very valuable to insurers and hospital systems and clinics and whatnot, because mistriaging is a burden on the system. It's a cost on the system. And if you can minimize that, that's obviously good. And so this is basically the interface of one of their products. And so imagine your hospital system or your HMO or other type of entity using this to kind of help triage you. So we'll just kind of go through this, and I'm going to provide an example of something, in my opinion, that would be concerning for high-risk chest pain, and let's see what it tells us. So it'll start with a message. So I'm going to say, I am having chest pain, and let's see what it does. So could you please share your age and sex assigned at birth? This information is essential for accurately assessing your chest pain. So let's say 82-year-old male. So obviously any 82-year-old male with chest pain, that's going to be very high risk no matter what. So it started today. And then what I'm seeing here is, I imagine this, I imagine the patients probably wouldn't see this, or maybe they would, but it looks like there's this little tab that you can click on that says show reasoning. And when you click on it, it says, based on what you've told me so far, your symptoms may be caused by high blood pressure. Understanding the nature of chest pain, such as severity and character, is crucial for determining its potential cause and urgency. So I've given it obviously very minimal information at this time. Could you describe the chest pain in more detail? For example, is it sharp, dull, burning, or tight? Sharp in the middle of my chest. And these are questions that, we all learn in med school, triage nurses ask. So those kind of basic questions where you're kind of seeing what is high risk and whatnot. And now it looks like it's actually providing me with this kind of table where I can click answer. So this is obviously going to be quicker. So palpitations, no. Severe chest pain, yes. Loss of consciousness, no. Pressing chest pain, yes. Less than 30 minutes or between 30 minutes and 8 hours, I'm going to say yes and no. And then we submit this, and let's see what happens. Your symptoms, including severe and sharp chest pain, are concerning and could indicate a serious condition. I strongly recommend that you seek immediate medical attention by contacting emergency services or going to your nearest hospital. Would you like to continue the assessment, or do you need assistance with anything else? And then show reasoning. And so it looks like it's giving me a differential of unstable angina, heart attack, stable angina. So that's pretty accurate. So I'm going to see if I can reset this, and let's give it another kind of lower risk scenario. So let me see if I can kind of, start new chat. And we're going to do chest pain again, but this time I'm going to give it some less concerning features and see if we can differentiate that. And as I'm kind of typing through this, some of the other products they have, so they have a few offerings. One is this kind of tool that is obviously helping triage. So this is their self-triage tool. They also have a pre-visit intake tool that I guess could be obviously really helpful with like pre-visits for telehealth or even in person. And then they actually had a nurse triage copilot, which was really cool. I'm not sure if it's completely out yet or not, but it was. I did see it mentioned on the website, and it's essentially where you have a conversation. So I'm not sure if you've used ChatGPT, but they have that voice feature where you can have that conversational tone with a AI entity that sounds very human-like. So they have that as well. And what it does is it asks you all the kind of nursing triage questions, and then it actually connects you to the nursing line, where the nursing line folks can see everything that you had told that entity and kind of speed up that process. So let's say, so I'm going to say chest pain started earlier today after coughing a lot. The other thing, as I was kind of looking through Informedica's website and some of the things that some of their team members pointed out, is they have a lot of peer-reviewed studies. And so a lot of these entities and companies don't really have those, or they do, and it's not truly a peer-reviewed studies, or it's looking at a really small sample size. I was impressed at what they had. I'm just going to change the tab here real quick and kind of show you, there was a, yeah, access full library of publications. So they're very transparent about it, and then it takes you to all their peer-reviewed publications. And as you can see, there's a whole bunch of them, and you can actually click on their PDFs. They're on PubMed and JAMA and all these well kind of recognized publications. And so I've seen other companies, other AI companies in particular, where they will be kind of sly about them, or they'll say their studies, and then when you ask them for it, it's maybe not a true study, or maybe it's like something they did with like 10 people, things like that. So let's say it's 2 out of 10, and we're going to call it dull. And then I'm just going to say no to all of some of these high-risk questions. Obviously, these are all the high-risk characteristics of chest pain. And so we're just going to say no. We're going to say no shortness of breath, none of that, no rapid breathing, no fatigue, no heavy sweating. And yes, I had an upper URI in the last 8 weeks, not overweight or obese. None of the above. So one of the other things as I was looking through their stuff was that they're using inference engines, right? So they're not using decision trees, which is obviously where the AI part comes in. They're inferencing from knowledge graphs of a ton of data they've gone through, rather than having an algorithmic kind of decision tree, which a lot of these tools use, which is what sets them apart. The other thing is they've been around for a long time. I believe 13 years, don't quote me on that. And so they have a lot of data, and they're not like a lot of these companies that have popped up over the last 2 or 3 years during this AI hype cycle that maybe don't have all of that background. This isn't a company that just popped up and they may not be here tomorrow. They have been here for a long time. They've been developing these tools for a long time, and obviously generative AI and some of these tools are now obviously better because of that. But this isn't something that popped up over the last few years. So thank you for your detailed information you provided so far. Before we proceed with further questions, you can review the list of findings we've gathered from our conversation by using the findings button. So it looks like there's a findings button here. Okay, and so that's basically everything I've answered. So I'm just going to say it. Can I get an answer on what I should do? Because I imagine some patients will be a little impatient and they would want quick answers. So, okay. Dry cough without phlegm or mucus. And it's very thorough, that's what I'm saying, which I like. Obviously, in person, a lot of this information is going to be asked. And so I know patients may find this like it may be like a little too many questions, but this is what we would in fact be asking you if you came to the hospital. So I'm basically answering all the low risk things and characteristics for like a URI. And I'm hoping it tells me either to go follow up with my PCP or not go in at all. Asking about my nasal discharge, I'm going to say it's clear. No difficulty speaking. It is really thorough, which I like, because the last thing you want is something that gets you a quick answer and then you're missing emergencies. And if I'm a clinician or a hospital system, then this is going to make me want to buy into a system that is thorough. And so it says self-care may be enough. Based on the symptoms you've described, it seems likely that you're experiencing a mild respiratory condition such as a common cold. This is not an emergency, and self-care measures should suffice for now. Possible conditions: postnasal drip cough, hay fever, common cold, chronic sinusitis. So I love this. We obviously saw an example of high-risk chest pain. That's going to be chest pain in anyone in their 80s. There is no such thing as low-risk chest pain. It immediately made me say, go to a hospital, or it wanted me to go to a hospital, call EMS, which I like. It didn't make me go through the whole list of questions and then tell me that, because obviously if you're having chest pain and it's a massive heart attack or aortic dissection, you want to get that person to the hospital as soon as possible and not have them in front of a computer answering questions. And so then it looks like when it gets to the end, it suggested self-care, but I could also schedule a consultation, go to an emergency department, and call an ambulance. So it does give you options. And I imagine, depending on who's buying this and how they're implementing it into their systems, they're going to enable that to directly go into their scheduling software, things like that. These are some of the partners they worked with. Obviously, some recognizable names there: Teladoc, Microsoft. So it looks like they have lots of established partners, thousands of organizations since 2012. So yeah, they have been around for a really, really long time. This is basically what I was using, the self-triage symptom checker. This is the pre-visit intake that I briefly mentioned, and that's the voice-like nurse triage copilot, which, it feels like you're having a conversation with a normal person, and then it relays that all to a nursing staff member. Really, really cool. I think this is exactly the type of thing AI should be used for, where we are trying to decrease the burden on an already a very densely populated emergency department system, and the more people that you can safely triage to other places, whether it's urgent care or telehealth, the better. I do like that it is really, really thorough. That gives me more confidence in something that I would possibly put out there. But really, really cool company. And so thanks to the team for giving me access to this. And then once again, if you are a company, a founder, anyone with a tool that you'd like me to create a little mini episode like this around, send it my way. Thanks for watching.